Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Dr. Anjali Rajpal. Dr. Rajpal, how are you doing today?
I'm great. How are you?
I'm well, happy to be celebrating World Health Day with you, and particularly as it relates to something that's very important that most folks miss is oral health and cosmetic oral health. So, could you just give the community a little bit more information about who you are and what you do for a living?
Sure. My name is Dr. Anjali Rajpal. I'm a cosmetic and general dentist here in Beverly Hills. The name of my practice is Beverly Hills Dental Arts. And I basically am blending art and science to create beautiful smiles in a very natural, healthy way that lasts for the long term.
Why is oral health so important for overall health, and what are like the three common misconceptions about oral health?
So the main issue with oral health is the fact that we build up a lot of bacteria in our mouth. And that bacteria, if it gets out of hand, it very easily can travel to the rest of the body because the gum tissue barrier is very thin. So if the gums get very inflamed and bleed a lot and there's just a breakdown in the structure, it can cause the bacteria to enter the vasculature and travel through the blood vessels and basically infect other organs, causing issues throughout the rest of the body.
So then how does you talk about other serious health conditions? Do you have some that are connected? Is there something like maybe like heart disease or diabetes or anything that you think of that can think of that bad oral health contributes to?
Yeah, of course. So the main ones are linked to heart disease, which is heart disease and stroke, potentially endocarditis as well. And they have found that the same bacteria that are in tartar or calculus there are the same bacteria that can actually clog the arterial lining of the vasculature. So that's why you can end up having constriction in these areas and get blood clots and issues like that that affect the heart because it's interrupting the flow of the blood. And then also diabetes, it's clearly linked to as well. As there's more inflammation in the gum tissue, there's actually a vicious cycle that occurs where because the blood sugar is not being controlled very well and there's less insulin resistance, then you end up having the body has less of an ability to control the inflammation. So again, the bacteria gets out of hand, and this high blood sugar that's in the body just isn't able to fight the bacteria as easily. So it kind of causes this cycle of inflammation, which inhibits the body's ability to heal. So those heart disease and diabetes for sure. And then because the bacteria also have a very easy link straight up to the brain because we have sinuses that are open and just easy pathways straight up to the brain. If an infection gets out of hand in the mouth, then you can end up with stroke, as we said earlier. But the bacteria can also just over time cause Alzheimer's because they could potentially travel to the brain. So they're finding links between cognitive decline and oral health as well. And then preterm pregnancy, supposedly gum inflammation can cause low birth weight and preterm pregnancy in children. And it's potentially been linked to arthritis as well, just inflammation in the joints. And I don't remember what else, but those were all the
Wow,
main potential systemic issues that oral bacteria have been linked to.
thank you for that. And so let's switch now. Cosmetic dentistry. I think a lot of people, particularly on social media, have, they're exposing their smiles. Rick Ross recently created a new dental partnership with his dentist and opening up practices. When we talk about cosmetic dentistry, I mean, could you just kind of relate to the community how important it is to just improve appearance, but also overall health and well-being and confidence, how important cosmetic dentistry is?
Yeah, I mean it really has a major impact on professional relationships and personal relationships. And obviously it's affecting your health in the long term if you're not addressing any dental issues. So with some patients, I've seen that they come into our office and they've had broken down teeth or a lot of crowding or just a smile that they're not proud of. And they end up hiding their smiles. So they end up repressing their emotions because they're not freely expressing joy. So if you're hiding your smile, not only are you stifling your ability to share joy freely, but you're leading to miscommunication with other people around you because you want to show that you want to share happiness with them, but you're inhibited. So they may misinterpret who you really are and think that you're actually cold and not as friendly as you may seem. And that can create havoc in the workplace too if you're a boss or an employee and your colleagues are misunderstanding you. So it makes a huge difference. And I've also seen and with people that I've done smile makeovers on, they maybe weren't getting a lot of acting roles or they weren't getting their dream job yet. And honestly, after transforming their smile, because it just lights them up so much more and makes them more presentable, it definitely improves their professional careers because I've seen them land better opportunities really soon after I've corrected their smile. So it just lifts your emotions, it enhances your mood because you're releasing endorphins and serotonin when you smile. So if you're not able to do that, you're actually not allowing for great healthy brain chemistry to occur. You're actually inhibiting some of your neurotransmitters from being released as well. So it's really important just in terms of confidence and emotional health and mental health to feel like you can smile freely and actually maybe even want to smile more.
So to that point, what are the three most popular cosmetic dental procedures, and who do you think would benefit them from the most?
So, me personally, the three most common ones that I perform are porcelain veneers, cosmetic bonding, and Invisalign because I think those are what I use to transform the smile the most. So with porcelain veneers, they're thin shells of porcelain, which are just facings that are bonded to the fronts of the teeth. So that way you can mask anything that's going on underneath the teeth. If the tooth is more broken down, then we might need to use a porcelain crown instead, or we may use inlays on back teeth, which are little porcelain restorations that you place into the tooth. But basically, if your teeth are disproportionate or just they have discoloration throughout them, they're just not the right style of teeth that you wish that you could have, then we can completely reconfigure the way that they look entirely. So you can completely transform the color, the style, everything with porcelain veneers. And you can make them much whiter than maybe your teeth are able to naturally whiten with whitening gel. So yeah, you can just completely change everything up with veneers. Then with bonding, if my patients are generally happy with the proportion of teeth, but they just have some minor things that need to be corrected. Maybe their teeth are a little bit worn down or chipped, and there's just they're basically for the most part healthy and they don't want to change too much of their tooth structure. Then I can just sculpt some composite bonding onto those teeth and reconfigure the proportion and everything a little bit so that it just enhances what they have already. And then Invisalign is just a game changer for crowded teeth and spacing teeth because the way that I plan out my cases is very time efficient and I can really line everything up pretty quickly so that their teeth are in a much healthier position, which is so important for the long term because you want the teeth to be in a healthy position and in a proper alignment so that your toothbrush can actually clean all the surfaces evenly. and your oral hygiene routine is actually effective, so that your teeth last through the long term, and so that the teeth forces are in balance too, which will again help them last through the years.
So then out of those three, what are, I don't want to assume any of these three are applicable to this next question, but which are the most affordable cosmetic dentistry options to those who may not necessarily have access to capital, spend $10,000, $20,000 on, cosmetic surgery or cosmetic amplifications? Out of those three, are there any other three that are the most affordable? What comes to mind?
Well, you can always do teeth whitening to at least lift the shade of your teeth, which will make a big difference in itself. Invisalign is Invisalign varies depending on the case. So you can always work with whoever's taking care of you. Maybe there's a way that you can split up the payments or do something that makes it more manageable financially for you. Porcelain veneers are definitely the most pricey option. So if that ends up being too out of the budget, even with being able to split up payments or anything like that, then bonding would be a more affordable option compared to that. So, so yeah, there's always something you can do that basically we you would just need to see what all of your options are and then see what is the best option that fits you financially that you could work with to start with, and then maybe down the road, if you want to advance to something that you later become able to afford, you can always upgrade to something else.
Thank you for that. So now let's think about, so that's the solution, right? And let's talk about preventative care and accessibility. So, what are three key steps that people should take to maintain healthy teeth and healthy gums that they should do daily?
I mean, it's the basics, brushing and flossing. So you want to make sure you're using a soft bristle toothbrush, not brushing too aggressively, but you need to be brushing at least twice a day. And then flossing, you need to make sure you understand a proper flossing technique where you properly clean between all of the contacts. That should be at least once a day. If you have some gum loss underneath the contact points, and your brushing and flossing is not getting in all of the areas properly, then you can incorporate a water pick or power flosser, which is a water jet, which will help to get underneath a lot of those contact points a lot more easily. And even if you in general just have a lot of inflammation, one of those, it's good to incorporate one of those as well. And you can also incorporate a mouthwash. A natural mouthwash would be great, or a stronger antibacterial mouthwash if there's a lot of bleeding and a lot of inflammation. But the key is honestly coming to visit us every 3 to 4 months, because you can do the best job that you can, but we can see so much more than you're able to. So anything that you've missed, we definitely need to clean off. And we need to check the health of your gum pockets and take x-rays and just make sure that nothing is going on that you cannot see yourself, that we need to catch before it turns into a bigger, more costly problem.
What are your thoughts on cocoa floss and oil pulling, coconut oil pulling? I know that's a recent preventative holistic craze, but what are your thoughts on that as well?
Well, coconut oil stems from Ayurvedic principles. So coconut oil is actually a great antibacterial and antifungal agent. So there's no harm, obviously, at all to be using coconut oil. It's very natural. And supposedly it can just help loosen up the plaque a bit before you brush. So it makes everything just go more smoothly. And yeah, the antibacterial and antifungal properties will help with inflammation as well. So yeah, I think it's definitely great to add on to your regime as well.
I also want to bring up, what are your thoughts on reducing processed food? I mean, in my mind, I'm working on a passion project where, and I'm a conspiracy theorist at heart, I do think that the increased use of businesses using processed food is having a detrimental effect on teeth, right? And in your experience, have you seen an uptick in disorders associated with gum disease as it relates to processed foods, knowing that companies are trying to increase their margins and are putting more synthetic things in food instead of all natural things?
Yeah, it's unfortunate in this country that we don't have the best regulations for minimizing the use of these toxic preservatives and synthetic ingredients in our food, because that is not food. That does not provide nutrition. It actually just disrupts our ability to absorb the nutrients that we actually really need. And it causes inflammation, and it weakens our immune systems. So yeah, they're not, it's not food. They're really just toxic components that are not really improving our health. So we need to be very mindful of what we are putting into our bodies, because our bodies are temples, and anything that you ingest is going to have an effect obviously on the rest of the body. So yes, by weakening the immune system by eating processed foods, you're more prone to inflammation in your body completely, including inflammation in your gums. And then a lot of processed foods or sugary acidic drinks, things like that, those just end up weakening the enamel, and they make you so much more prone to dental decay. So then you're just more easily able to get cavities along with the gum inflammation.
Dr. Rajpal, I really appreciate your insight, your wisdom, your leadership, sage advice on oral health. And my last question for you is, there's a younger generation, there's a wealth transfer that's about to happen, and it is happening, and people are coming into money. And at the same time, people don't realize that a great smile is money. What would you ask the community to do, knowing that they want to reach the next level, but aren't really convinced that oral health plays a major role in reaching that next level? What would you tell this community?
I mean, the first thing you notice on people when you meet them is generally their eyes and their smile. And smiling is so infectious. So if you are radiating with your smile, you just become so much more charismatic, and things just will work out better for you. So obviously, your health, overall health is key, because if you are not taking care of your smile and you're creating inflammation in the rest of your body, then you're not at your highest, most functional capability. So obviously it makes a big difference. You don't generally want to have bad breath. Having better breath makes you more approachable as well. So that needs to be taken care of. That's why we have you guys come in and make sure that we are taking care of whatever you haven't taken care of. And yeah, it just having a beautiful, healthy smile makes you radiate and just makes you so much more approachable. And so, as I said earlier, it just will naturally improve your personal relationships and your professional relationships. It's an investment that actually really pays off in the long term.
Thank you so much, Dr. Rajpal. Is there like, are you on social media? Is there a website that folks can go to in order to come in and get scheduled for their annual teeth cleaning and an oral consultation?
Yes. So the name of my practice again is Beverly Hills Dental Arts. Everything is basically Beverly Hills Dental Arts. My Instagram is at Beverly Hills Dental Arts. So is my TikTok. So is my YouTube. And then my website is bhdentalarts.com.
Thank you so much for your time. I really appreciate the advice and the wisdom. Thank you so much.
Of course. Great talking to you.